Good afternoon, my name is Romer Labajo, and today is April 4, 2026. I'm going to do my lung and thorax examination video. So first, I'm going to ask my patient for verbal consent. Do you consent me to record the entirety of this video, of this encounter, to upload in YouTube as unlisted for my profession to be engraved?
Yes.
Yes, so I have my patient's verbal consent. I'm going to do integrity check. First, I'm going to show my camera. That's my camera right there. There's no notes. I'm going to show my ears. And I'm going to show the 360 room scan. I'm going to show the ceiling and the floor. So I'm done with the checks. Now I'm going to start with my assessment. First, I'm going to do hand hygiene, and I'm also gonna show my stuffs here that I'm using. There's no notes in here. It's just a ruler and a hand hygiene. First, I am going to do hand hygiene. Knock knock. Hello, Anthony.
Hello.
Hi, good evening. My name is Romery, student nurse practitioner from United States University. And today I'm going to do your assessment of your chest, okay?
Okay.
Now that I have my patient's consent, I am going to start my assessment. Upon inspection, I'm just gonna pretend that my patient shirt is off right now. But for the purpose of this video, to preserve my patient's privacy and dignity, I'm going to keep his shirt on. Also, gonna be pretending that I'm seeing his chest. So I don't see any deformities. I don't see any pectus excavatum, no pectus carinatum, no barrel chest that could indicate COPD. I don't see any abnormalities so far. Also gonna check for the antero-posterior ratio, transverse ratio, and it is 1:2. The AP transverse ratio is 1:2, and it's a normal finding. I'm also gonna be checking the respiratory rate of my patient. For the purpose of this video, 1 minute has passed, and it is 18 regular rate. Also gonna be checking my patient's respiratory movement and exertion and effort, and it is no, I don't see any labored breathing, I don't see any retractions, I don't see any use of accessory muscles, I don't see any diaphragmatic breathing, and I don't see any kinestokes, I don't see any cosmals or any abnormal breathing. Any labored breathing, there's none. And that is a normal finding. I'm also gonna be checking for my patient's nails. Is nail beds, it's pink. Also in the lower extremities, it's pink. And the cap refill is good. It's less than 3 seconds. It's normal. I don't see any clubbing. That could indicate that the patient is having cystic fibrosis for the respiratory section or any congenital heart disease. After that, I am going to start on the palpation area. On the next, I'm going to be starting on the respiratory excursion. So respiratory excursion, I'm going to put my hand around your 10th rib, and This is to this is to measure the lung expansion, lung capacity, and the diaphragmatic function. I'm gonna be checking for the extent and the symmetry of the lung expansion and the diaphragmatic expansion. So I'm gonna ask you to take a deep breath and breathe out. Okay, breathe in and breathe out. I can see that it's symmetrical anteriorly. I am also gonna check posteriorly, but I'm not gonna be able to show it in camera. But also I am gonna be putting my arms on the 10th rib of my patient, and I'm gonna ask you to take a deep breath again and breathe out. Breathe in and breathe out. I can see that it is symmetrical, and anterior and posterior both are around 3 to 5 centimeters, and typically 3 to 5 centimeters is a normal finding. Next is I'm going to check for the tactile fremitus. So tactile fremitus is a test for vibrations. I am going to tell you to, as soon as I put my hands like this, put my hands down here, you're gonna say 99, okay?
Okay.
So it is a test for vibrations, and if there is an increase or unilateral increase or decrease in vibration, that is an abnormal finding. An increase signifies that the patient is having like a fluid filled or a solid filled lung, and it could signify that the patient is having pneumonia. A decrease could signify, a decrease in vibration could signify that the patient is having any obstruction like or air-filled lung like pneumothorax, emphysema, or asthma. So now I'm going to start.
99, 99, 99, 99, 99, 99, 99.
Okay, I don't hear any unilateral increase or decrease in vibration, and that is a normal finding. Now I'm gonna do it on the posterior side of my patient, and same thing.
99, 99, 99, 99, 99, 99.
Same thing, I don't see or I don't feel any unilateral increase or decrease vibration on the posterior area of the chest of my patient, and that is a normal finding. Next is I'm gonna check for the costochondral tenderness. It is a check for costochondritis. A costochondritis, it is like a harmless inflammation on the connective ribs here on the sternum, and if there is any pain upon palpation, that signifies a positive costochondritis. So let me know if you feel any pain, okay?
No pain, 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 no pain.
And that is a normal finding. So I'm done with the palpation. I am now going to start the percussion. I'm going to percuss all the lung fields using a ladder technique. I'm gonna start percussing here. So I'm gonna be using my middle finger or third digit to percuss my non-dominant hand here on the patient's skin, and my dominant hand percussing. and I can only hear resonance, and that is a normal finding. I am also going to percuss the back. Can you turn towards the side? Maybe we can show that. Yes. And also using my non-dominant hand, the third digit, and this one, the third digit, too. Using a ladder technique. And I can only hear resonance. So next, that is a normal finding. Next, I am going to use a marker and a ruler to check for my patient's diaphragmatic excursion. That is gonna be from the scapular area. I'm gonna be percussing until I from resonance until I hear dullness. So whenever I hear dullness, I'm gonna start marking it, but I'm not gonna mark on your shirt. I'm just gonna put it in dent. And then I'm gonna do the second test and mark it again. So the normal finding should be 3 to 12 centimeters. Okay. I'm gonna be asking you to take a deep breath and then exhale fully. Okay?
Okay.
Now take a deep breath and exhale fully. Now I'm gonna start percussing. I'm hearing dullness now. I'm gonna indent here. Next, I'm gonna do the second test now, and I'm gonna ask you to take a deep breath and hold it.
Okay.
Take a deep breath, hold it. You can breathe out now. Okay. So now I have my marking. And it's 4 centimeters, and that is a normal finding. So, for this diaphragmatic excursion, I will be doing bilaterally, but for the purpose of this video, I'm only doing one. But in real clinical setting, I'll be doing both and then compare. So after the percussion, I am going to auscultate in the same manner. I'm going to auscultate in a ladder form or ladder technique. And I should be hearing bronchovesicular on the top lobe, on the upper lobe, and vesicular on the lower lobe. And whenever I move my stethoscope, I'm gonna be asking you to take a deep breath and out. Breath and out. Just breath and out, just normal. Okay. 1, 2, 3, start. Out. So checking the lateral right and lateral left. And I'm not hearing any adventitious breath sounds. I don't hear any wheezing. I don't hear any bronchi. No I don't hear any abnormalities, but I can only hear vesicular and bronchovesicular on the lung fields. Now I'm also gonna auscultate on the posterior area. And same thing. Take a deep breath and then out. Breath and then out. Breath and then out. Breath and 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 out. And same thing, I don't hear any abnormal breath sounds, adventitious breath sounds like wheezing, ronchi, and any crackles, growls, none of that. Only hearing vesicular and the bronchovesicular on the upper lobe and the lower lobe vesicular. So, and that is a normal finding. So next, I'm going to check for bronchophony. So bronchophony is where we listen to, is where we auscultate the patient's lung fields and listen to whenever he says 99, the word 99, and it is a test for consolidation or pneumonia. So positive test is whenever I hear clearly the 99 word that he's saying or whatever word he's saying, and I will be expecting to hear a muffled sound or a quiet sound. So whenever I move my stethoscope, I'm gonna be asking you to say 99 again, okay?
Okay. $99, $99, $99, $99, $99, $99, $99, $99, $99, $99, $99.
Okay. So far, not hearing it loudly, just a little muffled sound, and that is a normal finding. So it's negative for pneumonia for the anterior part of the chest. Now I'm also gonna listen in the posterior part of the chest.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
So far I don't hear any abnormalities, and so far it's the same. I'm hearing a muffled sound of 99, but it's not clear, so it's negative from consolidation, it's negative from pneumonia. And I'm gonna just think if I'm forgetting anything. And I think that's it. Thank you for your time, Anthony.
Thank you.